If you are having sciatica symptoms, you are probably wondering what is causing it in the first place. Today, we are going to discuss the top 3 causes of sciatica symptoms, how to know which one could be affecting you, and what you can do about it. For many people, sciatic nerve symptoms come on suddenly. And what happens is that they have pain that maybe starts in their low back, definitely goes into their hip, may travel down the back of your leg and to the side of your calf or the back of your calf. And this pain, when it comes on, is often a sharp, shooty pain, and people feel like it just came out of nowhere. So if that sounds like you, then you're in the right place, because today we're going to help you determine what it is that's actually causing your sciatic nerve pain. The first one we're going to start with is the most common cause of sciatic nerve pain, and that's either a herniated or a ruptured disc. You see, the sciatic nerve is made up of the nerve roots of L4 to S2, and in between L4 and S1, so that's 2 of the lumbar vertebrae, there's a disc. In between L5 and S1, there's also a disc. That disc can either become herniated, which means it's putting pressure, it's bulging out a little bit, or it can completely rupture, which means the outside fabric of it has dissolved and you're getting discal material, so material that's supposed to be inside the disc is actually coming outside the disc. The reason why that is such a problem, other than the fact that your disc is no longer working completely normally, is that it puts an inflammatory exudate or an inflammatory soup that bathes that nerve. So that nerve can actually be irritated. When it's directly irritated, we call that a mechanical irritation, but it can be indirectly irritated by this inflammatory soup that it's now being bathed in. Because see, nerves aren't really smart. They just know that there's some kind of pressure or something that's irritating them. They send the message up to the brain and they say, hey, I'm irritated, and brain does what it does and tries to respond to that by sending help. Now that help is not always helpful, because one of the big things that will do is cause the muscles to contract. If your muscles in your low back contract and you have a herniated or a ruptured disc, that actually puts more pressure on the disc, which only makes the situation worse. So a lot of people have a sudden sharp onset of pain, and it seems to actually get worse as things go along. And that's because the muscles are starting to tighten up. They're putting increased pressure on that disc, which is putting increased pressure on that nerve, which is making your sciatica symptoms increase. So what you want to be doing is doing some gentle motions to help relieve that tension. We got to be careful what motions we do, though, if the disc is affected, because we don't want to cause any abnormal motions that cause increased pressure on the disc. The second most common cause of sciatica symptoms that are traveling down the back of your leg is actually spinal stenosis. Now, this one is a little bit different than the typical sciatica symptoms in that it usually affects people over the age of 50. It usually starts going down both legs at the same time, and it usually isn't a sharp onset. So it's not like all of a sudden you go to plug in the vacuum cleaner and you have this sharp onset of sudden pain. This is more gradual and tends to come on over time. And again, it tends to come down both legs. Why that happens is because spinal stenosis is actually putting increased pressure on the spinal cord. And so that's why you have symptoms that go down both sides as opposed to one side or the other. And it tends to start in the low back, go down into the glutes, go down and follow the sciatic nerve down into the hamstrings and calf over time if it's left untreated. Another sign of this is that you may have noticed that as you get a little bit older, you want to bend forward more. And most people tend to notice this when they go grocery shopping. So you may go grocery shopping and grab a cart and you're just used to doing that, but then you start to realize, I need that cart in order to be able to walk through the grocery store. Because a grocery store, it's a bit of a distance as you're going up and down the aisles, and you start to rely on the cart and realize that if you don't have the cart, you're not going to be able to make it through the grocery store because your symptoms are going to increase so much. People often tell me with spinal stenosis that as long as I sit down for 10 minutes, then all my symptoms go away, and then I can continue walking on. So I had one patient once who was suffering with this, and he went to the gardens up in Victoria, and he had to go walk from bench to bench. So basically he could enjoy the gardens, it just just took him a while because he had to walk to the next bench and sit and enjoy the gardens, walk to the next bench and sit and enjoy the gardens. But that's how he was able to make it through. I understand that's not how you want to live your life, but that is a good idea if you are really struggling at this point in time. Another way that spinal stenosis is different than the other forms of sciatica is that it tends to get worse when you're walking or moving. So a lot of people who have a disc problem or even a piriformis problem tend to feel better with more movement. Spinal stenosis, when you're standing up, especially if you do stand up straight, are actually going to have increased symptoms when they're walking or when they're moving around, as opposed to the other two forms. So if you find yourself preferring to be sitting, and especially if your symptoms go away 100% when you're sitting, chances are good that you probably have a spinal stenosis as opposed to the other forms of sciatica. And the last common cause of sciatica symptoms is piriformis syndrome, or where the sciatic nerve is getting irritated as it goes through the piriformis. You see, the piriformis goes from the sacrum, which is that heart-shaped bone at the base of your spine, and it travels out the side towards your hip. It's kind of a thin, strappy muscle, basically. What happens is that the sciatic nerve goes either underneath it, on top of it, or right through the middle of it. All of us are a little bit different, and so all of these are considered normal because generally it's about 33% of the population that has each one of them. But if you're one of the lucky ones who has a sciatic nerve going through the piriformis or underneath it, and that piriformis gets tight, then that puts increased mechanical pressure on the sciatic nerve. These people usually don't have low back pain, and they don't complain about any symptoms in their back. Usually their muscles in their back are not that tight. They usually have pretty good motion in their back, and they don't have too much problems in their back. They have hip problems or pelvic alignment problems. And often it's the pelvic alignment problems that cause the sciatic nerve tension in the first place because it causes increased stress to the piriformis. You see, the piriformis is a muscle, and when the pelvis gets malaligned, it's one of the ones that tries to help by becoming very tight. And when it becomes very tight and puts pressure on that sciatic nerve, it causes a sciatica type symptom. The challenge with this is that you can do some self-massage for the piriformis, you can do some stretches for the piriformis, and this will make your symptoms go away for a short period of time, but you really need to figure out what caused that piriformis tension in the first place in order to properly relieve that piriformis tension in the long term, which will then relieve your sciatica symptoms. All right, there you go. So if you're suffering with a sudden onset of sciatica, chances are good that it's either A, a herniated disc, or B, piriformis syndrome. If it's a herniated disc, chances are good that you have low back pain, and you might even feel unstable when you're trying to walk or move around. If it's a piriformis syndrome, chances are good that your pain actually starts in your hip and then travels down the back of your leg. And you might have a pelvic malalignment issue that would be really helpful to address in order to relieve that piriformis tension. Now, if you have pain down both sides of your leg, that gets relieved particularly when you're sitting, chances are good that you have a spinal stenosis. And there's still some things you can do about that. But that way you know what's causing your pain, so you know when you're doing your research what you should be looking out for. Okay, there it is. Now that you know the 3 most common causes of sciatica, which one do you think is affecting you? Are you suffering with true sciatica pain, or what I've termed phantom sciatica pain? Today we're going to discuss the difference between true sciatica pain and phantom sciatica pain, what starts phantom sciatica pain, and how to treat phantom sciatica pain, because it's different than true sciatica pain. Ready? Let's go. We'll start with true sciatica pain. True sciatica pain is sharp, shooting, burning pain that usually starts in your low back or your glutes and goes down the back of your leg. Phantom sciatica pain is a term I have created for people who suffer with what's more of a fascial pain than a nerve pain that usually comes on with prolonged sitting. Now, many people who struggle with this have had a previous episode of sciatica pain, and they've had to take the appropriate steps to make sure that they deal with the sciatica pain. But phantom sciatica pain has to be treated differently because, again, it's more of a fascial issue as opposed to a nerve issue. You see, the sciatic nerve travels in and out of the fascia throughout the low back, hip, and lower leg, and it can get stuck as it goes in and out of the fascial sheaths. When it does that, the pain is a deep, achy pain that occurs along the same path as the sciatic nerve because it's still the same nerve that's affected, but it's a different pathology. So this is not an active inflammation that needs to be calmed down. This is a fascial tension that actually needs to be stretched out. And if you've watched any of my sciatica videos, I always say, don't stretch your sciatic nerve. And that's true when you're dealing with true sciatica pain, that deep, sharp, burning pain. However, phantom sciatica pain, we're going to treat differently because, again, it's a fascial issue as opposed to a primary nerve issue. Why does phantom sciatica pain start? As I mentioned previously, it's usually after prolonged sitting. So people will sit for a prolonged period of time. Usually they're not in the best posture. This often happens in car trips because you're sitting for a long period of time and it's nearly impossible to get those seats correctly fitted for you. And you're stuck with that vibration for hours at a time. Often, if you've previously had sciatica, this will aggravate your symptoms and actually cause a phantom sciatica pain. However, if you sit for prolonged periods of time at work and you don't have good foot support, that can also increase your sciatica symptoms. I actually have one patient who would go to a bar on Friday night and sit on a bar stool and her feet kind of hung down. There was a place to kind of rest her feet, but not really place her feet. And every time she came into the clinic, she's like, hey, I'm having this sciatica pain. We talked about it and realized that it was from the bar stool. So instead of sitting on the bar stool on Friday night, she just had to go sit at a table so her feet were firmly planted on the ground. All right, the important question is, how do I treat phantom sciatica pain? These are the top 4 things that I recommend. Number 1, you need to do some stretching or flossing of the sciatic nerve. Now again, this is not for you if you have active sciatica pain. It's if you have that deep, achy pain that goes down the back of your leg that I call phantom sciatica pain. For you, I would recommend stretching your hamstrings, your calves, and doing some flossing to get that nerve moving correctly. Because if that nerve is getting stuck in the fascia, you need to floss it back and forth. And the idea with flossing is just like you're flossing your teeth, you're going back and forth, back and forth. And this helps to release it from anywhere that it's tethered down. The second thing that I need you to do is get your blood flowing, and the best way to do that is cardiovascular exercise. Now, you choose the exercise that you like doing the most because that's the thing you're going to stick with the best. However, I need you to be doing it on a daily basis for 20 to 30 minutes. This will help to get the blood flowing and allow the body to heal naturally. The fascia loves cardiovascular exercise, and we want to get as much blood flow to it as we can to heal. But it's a little bit challenging because fascia doesn't have a direct blood supply on its own. It has to borrow blood supply from the big muscles that it surrounds. So we need to do some cardiovascular exercise and get that blood pumping. The third thing that I need you to do is to watch your low back motion. Now, just because this is a phantom sciatica pain and not a true sciatica pain, it doesn't mean that your low back motion can't impact this, okay? You have fascia in your low back, you have fascia in your hips. You need to make sure you are watching how you are moving very, very carefully, particularly if you tend to do triplanar motions. Now, this would be something like you're bending forward, you're also side bending and rotating at the same time. So many people think commonly of picking up the soap in the shower, or maybe you're plugging in the vacuum, where you're doing more than one motion at a time. You do want to be careful about your low back motion, even when you have phantom sciatica pain, because it is still that sciatic nerve saying that I'm irritated, and we don't want it to get any further irritated. And the fourth thing that I'm going to recommend you do is stretch your hip. Now, if you've watched any of my other videos, you know with true sciatica, I do not recommend stretching. However, with phantom sciatica pain, we need to get that fascia moving. And the best way to do it is to stretch the muscles in the hip. It is literally impossible to stretch fascia on its own. but all that fascia surrounds the muscles. So if we stretch the hip muscles, we're going to be passively stretching the fascia as well. Often, if you have sciatica pain, you need to do some strengthening of the glutes because chances are they've kind of shut off and stopped activating properly. So this video is going to go through not only my favorite stretches, but my favorite strengthening exercises for the hip to help you eliminate this phantom sciatica pain. And how are you looking for sciatica pain relief that will work in seconds to decrease your pain and get you back to doing the things that you love doing? Today, we're going to be discussing not only what sciatica pain is, so you can know whether or not that's what's bothering you, but we're going to be discussing things that you can do right now at home in seconds that will help to relieve your sciatica pain and get you back to living the life that you enjoy. First off, what is sciatica pain? Many people get confused if their pain is actually sciatica. So what you will experience if you have sciatica is either low back pain, that's a sharp shooting pain, pain in your hip that can be dull, achy, or sharp shooty, or you may have pain in your calf and into your foot. Now, a lot of people who have sciatica may not have low back pain. You can have sciatica that travels down the back of your leg, and that can still be sciatica even without low back pain. But chances are good that those are one of the spots that you're really feeling the pain. Now, if you're feeling the pain down the front of your leg, that's a different nerve. It still can be a nerve problem, but it's not a true sciatica problem. So the tips we're going to discuss here today are not going to be effective if you have pain down the front of your leg. This is for sciatica, which is pain that goes down the back of your leg. All right, so what are the 5 things that you can do right now to eliminate your sciatica pain? Well, the first thing I'm going to ask you to do is to use ice. I know a lot of people think, oh, it feels better when I use heat, but heat is actually aggravating the problem. You see, heat increases blood flow, and when you have increased blood flow in a stagnant area, it increases inflammation in that area. Chances are that your sciatica is due to too much inflammation and that nerve getting irritated in the first place. So what we want to do is calm things down. We want to use some ice to do that. Now, when I have people ice, I only have them ice for 3 to 5 minutes. That's what the research indicates is the most helpful amount of time. So you don't need to ice all day, every day. In fact, actually, that's probably contraindicated. But ice for 3 to 5 minutes, and if your sciatica pain is really bad, do it every hour. This will help to not only decrease the inflammation, it'll also help to decrease your pain, which will allow you to move on to step 2. And step 2 is making sure that you move as much as you can pain-free. Now, this is super controversial because so many doctors say, oh, you have sciatica, you need to go home and rest and not do anything for 2 weeks. Friends, it is not going to get better if you don't move for 2 weeks. Now, I understand in the first day or 2 after a sudden sciatica flare, you may not be able to move because it may be painful, anything you try to do. And I understand during that time, you need to be resting. But after a couple of days, you should be able to find some motions that are pain-free. Maybe some gentle rotation, maybe walking around the house, small, gentle movements that don't increase your pain. And these movements you need to be doing as much as you can pain-free. When I have patients who have a sciatica flare, often in the first day or 2, they need to just be doing ice, some gentle rotation in their low back, and allowing the tissues to rest. However, after that day or 2, often they're able to get up and move around the house a little bit, do some gentle walking, do some gentle stretching, and get things moving. Now, chances are good that you'll only be able to do that for a couple of minutes, and then your pain will start to increase, so then you have to go sit down and rest again. And definitely make sure you take your ice pack with you when you do it. And step number 3 is just as controversial as step number 2. I need you to stop stretching your sciatic nerve. So many videos out there are showing you how to stretch your sciatic nerve in order to decrease your sciatic nerve pain. Friends, I'm here to tell you your sciatic nerve does not like being stretched, and it is going to make things worse. Now, you may be saying, but when I stretch it, it feels better for a little bit. Yes, it does feel better for a little bit because it feels like, oh, there's a change. So you've done the stretch, the information has gone up to your brain, and your brain says, oh, there's a change in that, so that's better. Except for then it realizes that there's more inflammation, which is worse. So it actually increases your pain in the long term as opposed to decreases your pain. So I need you to stop stretching your sciatic nerve, stop listening to all those YouTube videos, and make sure that all the motions that you are doing are taking stress off the nerve, not increasing stress to the nerve. Now, friends, this includes sciatic nerve flossing, which again is very popular on the interweb. So I need you to not be flossing a hot, acute sciatic nerve injury. Now, there is a time to do that when things have calmed down a little bit. So after a couple of weeks, what can happen is that inflammation can increase the tension in the fascia. And at that point, the sciatic nerve is kind of tethered down in that fascial sheath. At this point, the flossing can be very helpful because it can help move it out of that tension area. However, you'll know you're in that spot when your pain becomes more of a dull, achy, I call it almost a phantom sciatic pain, because it's not true sciatic. It's not that sharp, shooting, stabbing, burning pain. It's more of a dull, achy pain, and you feel like you want to stretch it because it feels like it's not moving correctly. Now, usually that happens after a couple of weeks, but everybody is different. So for you, what I want you to notice is my pain that sharp shooty, or does it feel like the inflammation is down because I did all the icing and I did the gentle movements, and now that nerve is just tethered down and keeps getting irritated. The fourth thing I need you to do is to discover the root cause. You need to understand what started this sciatica problem in the first place. Now, I'm going to link a video down below. It's actually a webinar that I did. In the video, we discuss specifically the different structures that can be causing sciatica, as well as some things that you can do right now. And you can go download that video right now. And the last thing that I need you to do, and this may be the most critically important step, is to find a safe sleeping position for your sciatic nerve. A lot of people who struggle with sciatic nerve pain, it gets worse in the evening and it makes sleeping very uncomfortable. So I'm going to link a video here for you where I recommend and demonstrate the top sleeping positions for sciatica so you can find one that works for you, because when you're sleeping is when you're healing. So you want to make sure you're in the best position for your body. If you've recently started having sciatica symptoms that are going down the back of your leg, you're probably looking for some treatment that you can do at home right now to relieve your sciatica symptoms. There's lots of exercise on our YouTube page and all over YouTube of things you can do, but another thing that you can do that's really, really helpful is to massage the muscles that are causing the pressure on the sciatic nerve. So today we're going to talk about which muscles you should be focusing on, as well as how you should be massaging them, because we want to make sure we're not putting more pressure on that sciatic nerve. Now, acute sciatica that just started, like you bent over to plug in the vacuum cleaner and bam, you got sciatica symptoms, is usually caused by one of two things. The first one being a disc problem in your lumbar spine, and the second one being a tight piriformis. So the sciatic nerve starts from the nerve roots from L4 to S2, and there's discs in between the L4-5 and L5-S1. Those can become herniated or rupture and put pressure or mechanical irritation on that sciatic nerve. The thing is, the muscles also get really tight in response to that, which puts increased pressure on the disc, which causes increased irritation of the sciatic nerve, which increases your symptoms. So working on the muscles near there can be very helpful to help relieve your symptoms, but you do have to be careful, because if it's really hot and angry, you don't want to be irritating the sciatic nerve further. Now, the second thing that can cause acute sciatica symptoms is a tight piriformis. Now, I'm going to tell you that the massage we're going to do today will help relieve a tight piriformis. However, it is critical that you get to the root of why that piriformis got tight in the first place to solve this problem for good. So basically, this technique is going to be a band-aid just to help get you out of pain, but you really need to figure out, why did that piriformis get tight in the first place? Because chances are good that it didn't actually just happen overnight. It's probably a chronic pattern that's been going on for a while, and it just got tight enough to finally irritate that sciatic nerve. The techniques today are really geared towards helping to decrease your pain and improve your function, but they're not going to solve the problem in the long term. So definitely recommend checking out other videos on our YouTube page to look at what that long-term solution is. But for right now, let's get you out of pain. All right, so the first muscles that we can work on is the lumbar paraspinal. So these are these big ropey muscles, and if you're suffering with sciatica type symptoms, these muscles are going to feel really, really tight. So in order to work on them, we want to be kind of careful as we get into those knotty spots. And it's finding those spots of really tender areas. So really a trigger point is a hyperirritable band of tissue. And what happens when we get a trigger point is that muscle gets really, really tight in one particular area and can cause a lot of tension and pain in that area. So we want to find those spots and then kind of dig into them with your fingers. Now, if it's hard for you to reach it with your fingers, some people prefer to use knuckles, and it makes it a little bit easier to rub up and down. Now, I'm a physical therapist, so I tend to do everything over clothes, whereas massage therapists will tend to do things under clothes. If you want to do it under clothes, then I recommend you use a lotion to help it glide a little bit better. I love True Love's Deep Rub because there's no chemicals in it, and it gives you the effect of an icy hot or a biofreeze without having any of those chemicals in your body. Now, once these muscles are feeling better here, what I want you to do is go down to your iliac crest. So your iliac crest is your hip bones. So if you put your hands on your hips, you can feel those hip bones right there. Now, I want you to go just below the iliac crest. So there's a lot of fascial and muscle attachments along here, and this can feel really, really good to dig into. And you can even come all the way around to the sides of the hips and kind of help with that. So to get the sides of the hips, I like to use my thumbs a little bit more than my fingers, but you can do whatever feels good for you, and you can kind of really dig in there. There's a lot of attachments in there, and just loosening all of that up can be really, really helpful and take some of that pressure off of that sciatic nerve. Now, again, you can use a knuckle here. It's hard to use multiple knuckles here because it's hard to kind of get in there because it's a bony area. But if you want to use one knuckle there, if you feel like that gets in there a little bit deeper for you, then feel free to go ahead and do that. And just go along the iliac crest, releasing those fascial attachments and those muscular attachments. And that should help to decrease that tension through that sciatic nerve. Because the sciatic nerve is forming here from L4 to S2, and then it's going to be traveling down into the hip, and the next place it's going to hit is that piriformis muscle. So the piriformis runs from the sacrum over to the hip, and it's kind of a thin, strappy muscle that goes this way. So finding the area in there that's tender is important, but making sure we're not putting direct pressure on the sciatic nerve. So usually the sciatic nerve is kind of more in the middle of the muscle belly, but you'll know if you're putting pressure on it because it'll get really sharp and shooty. So avoid that area. Find another area of the piriformis that feels like it needs some work. And again, you can use fingers, you can use knuckles. You can even potentially use a racquetball to get in there and really dig on it. Now, my concern with the racquetball is that it's big, so it can be hard to avoid that sciatic nerve when you're doing it. But if you're really careful and keep it close to that sacrum, it can work for you. If you're going to use the racquetball, I recommend doing it on the wall. So you would put the racquetball on the wall, be standing there and just do some little mini squats. The little mini squats will help to get a little massage in that area. Now, some people will recommend doing a racquetball on the floor. I don't like that as much because it throws off the pelvis. So you have this rotation happening through the pelvis, which transcends all the way up into the lumbar spine, which could put more pressure on your sciatic nerve while you're doing it. So if you're going to do a racquetball, please do it on the wall to make sure that you're able to keep that pelvic stability. The next place the sciatic nerve is going to travel is through your hamstrings. Now, massaging your hamstrings can be a little bit difficult if you're doing it on your own, but one thing you can try is getting into the meat of the hamstrings right in the center, and you kind of put your fingers like that. And then you can do some self-massage. I like to go across the muscle belly, so that's coming out. So I'm starting in the middle and coming out to get some self-massage of those hamstrings. And usually those hamstrings are super tight if that sciatic nerve is flared up. So even this can be enough of a pain relieving technique. Again, we're not trying to make any big changes in the muscle. We're just trying to get that pain down because it gets really, really irritated, and that can be really, really difficult to deal with. A couple of other ideas, if you have a roller, they used to be called the stick, but there's all kinds of brands out there now. If you have a roller, that can be a really great thing to do on those hamstrings in order to be able to get that massage. Also, if you have one of those handheld self-massagers, that can be really helpful for the hamstrings in particularly if you can have someone else do it on you. So that way you could be like laying down on your belly, just make sure that your head's properly supported so you're not getting any neck pain. And they can use that massage gun on your hamstrings, which can be very helpful to get some relief. It can be a little bit more difficult to do it on your own. Now, my caveat with the self-massage gun is I don't like to use it on the lumbar spine or along the iliac crest or even on the piriformis if you have a really hot sciatic nerve symptoms, because what happens is that can actually put pressure on the sciatic nerve, which can cause increased pain and inflammation in the area. So when it's really, really hot, I don't like to use it on the lumbar spine, the iliac crest, or the piriformis, but I'm okay doing it on the hamstrings because the sciatic nerve tends to be pretty deep there and it's harder to put pressure directly on it. Now, your sciatic nerve symptoms may be going down into your calf. They may be going down the outside or the back of your calf. You may even have some numbness and tingling into your feet. If that's you, then I recommend doing some self-massage down there as well. In order to reach your calf, though, we don't want you bending really far forward, right? Remember, the sciatic nerve is starting up in the low back, so we want to bring that foot up towards you. So we're going to do much like we did with the hamstrings, in that we're going to go to the center of the muscle belly, and we're going to come out to each side just to decrease some tension, improve the proprioception, decrease the pain that's going down here. If your pain's going down the back of the calf, if it's going down the side, I like to take my hand and wrap it around and do some self-massage more with my palms. I feel like it's easier to get there. It can get kind of fingery if you're trying to use your fingers there. But hey, if that's what makes you feel better, that's absolutely fine. Some people will even run their palm down the side of their leg because that feels really good and relieving and helps them feel better. Whatever works best for you is absolutely fine. Different techniques work better for different people. Again, with the calf, if you have one of those rollers like the stick or something, that can be really helpful. And I definitely would recommend that for the calf or the hamstring. And again, on the calf, I'm okay with you using that self-massage gun. This one's a little bit easier to even do on your own if you're using it on the back of the calf. Now, if your pain is down the side of the calf, I don't like the self-massager as much because that sciatic nerve is closer to that surface, so that can actually make it more irritated. But in the back of the calf, it's deeper underneath that muscle belly, and so it's easier to get the massage of the muscle without aggravating the sciatic nerve. So those are the muscles that I recommend you working on if you have acute sciatica pain. So you can start at the lumbar paraspinals, go down along the iliac crest, into the piriformis, down the hamstrings, and into the calf. Really, you want to be massaging any of the muscles that feel tight. And remember, your goal is just to decrease some of the tension and particularly the pain. The goal is not necessarily to get in as deep as you can and work out all those knots. Really, you're trying to get that pain down a little bit so that you feel better. I always recommend that people ice after they do that self-massage, and that way, if you've increased any inflammation, it helps to calm things down a little bit. And if you've done self-massage all the way down, you can ice each area for 5 minutes. So it doesn't take too long and you can get that decreased inflammation throughout your body.